Medical doctors in Canada are driving buses, they are driving taxis, they are not practicing. I don't want to go to Canada to practice because I don't want to go there and become a taxi driver or start doing something else that is not my profession. Wow, who told you? A lot of medical doctors in Canada are practicing. Medical doctors migrating from Nigeria, from India, from Ghana, from all sorts of Africa, from all sorts of continents. Canadians are opening their arms, welcoming medical doctors every now and then. And they come there, practice, flourish, and then progress in their careers. People say all of these things because of information. Lack of information is what makes people say that, and probably the people that they talk to. In this video today, I'm going to be talking about the pathways that you can use as a medical doctor from Nigeria, Africa, or anywhere in the world to migrate to Canada. And I will show you that even you that is watching this, or your brother or whomever you know that is a medical doctor might or may be eligible to start practicing in Canada, but they probably haven't started the processing that because they don't have the right information. Today in this video, I will explain what you can do, the pathways you can do to move to Canada and start practicing right away. Welcome to my channel. My name is Manaria, Canada. I love to research about immigration. I love to research about migration news, how someone can migrate from anywhere in the world to different other continents, starting from Canada, UK, and US. I post videos sometimes more than once every week. There are times I post videos up to three videos in a week. Please kindly subscribe my channel. Share this information with people. There are so many people out there that might be eligible to some pathways and so many things, but they are not able to apply because they are not aware. Information is power. Information is key. Please, as you listen to what I'm going to be talking about today, remember to share. Don't be stingy with sharing. Share my channel with people, like my channel, comment on my channel so that I will be motivated and encouraged to do more videos for you. So you're welcome today. So on this day, we're going to be talking about how someone can migrate from Nigeria to Canada, or how medical physicians can practice in Canada. Now, in this video, I'm going to be talking about the pathways that people can use to start practicing in Canada. So now, basically, there are different provinces in Canada, and each of the provinces in Canada have their pathways. And one thing I need you to understand now is that Canada is in need of medical doctors, is in need of physicians. So many provinces are kind of loosening up the processes, and even shortening the amount of times that it can take you to do one or two things and all of that. However, I'm going to go ahead today to talk to you about the pathways. So there are two pathways, basically, for people who are just coming up, and there are also pathway for instance, somebody that is already a consultant in a particular field. All of these people, they have pathways, and this is what I'm going to be talking about in this video. So now they have, let's say, three pathways for someone to start practicing as a physician or a medical doctor in Canada. And trust me, it's not so tough as people out there project it. It's not what people say. I don't know the information people are getting. I don't know, probably people are not telling people what's going on. Some people probably move to Canada and, they probably are doctors and they move to Canada and, in the process of trying to settle, or, because you have to be working and all of that, in the process of trying to settle and all of that, they might just pick up a job and, they might be working the job and probably they're not able to write the exam, as soon as they came in. And by the time they want to start writing the exam, it might just be probably they have, exceeded the number of years that you're expected to have your currency of practice. And that means, for instance, those coming from Nigeria, if you are expected to have a particular level of currency of practice, and some people might be like, oh, I don't want to go back to Nigeria to go and start renewing my currency of practice. Imagine from Canada back to Nigeria again, considering a lot of things going on. So, and some other people might be like, okay, let me just take UK route, which is totally okay. If you want to go through UK route, it's totally fine. It's totally okay by you. But this video is not for us to start talking about those that prefer UK route and those that want to go through Canada route. This video is just to break the myth that people who are medical doctors in Canada, all of them are driving taxis and all. And I can categorically beat my chest to tell you that so many doctors in Canada who are from Nigeria, Ghana, and Africa, Indians, anywhere in the world are practicing. And they're following these pathways that I'm talking about. And not all of them are driving taxis. Yeah, I'm not also here to argue that there are no medical doctors that are driving taxi. But if you know a medical doctor that is driving taxi in Canada or probably taking up some menial jobs and all of that, everybody have different individual differences. Some people may have been that they did try the exam because they have jobs and they weren't preparing for the exam properly, and maybe they failed. And of course, you don't expect anyone to come and start telling you that, oh, I wrote the exam and I failed. That's number one. Some people might have been as a result of family differences, okay? Family differences, and they needed to meet up with family challenges, family requests. They needed to take extra jobs and all of that, giving a little time to studies and all, because sometimes the studies can be so tedious that it might require you to some people would even take out like 6 months of their time just studying, right? So you can imagine probably someone is having a full-time job and they probably have left some of these things many years back in school, and then they come and then they write it and they probably didn't make it. And those people you're talking with them, they're telling you that it's hard. The person might have been a consultant for like 20 years. Remember, if someone is a consultant for years, for instance, they might be so specialized in that particular field that, okay, you don't want to bring a consultant and start saying, oh, come and start writing, some things that they did 10 years back. It's going to take that. It's not that it's not possible for them to pass the exam. Yeah, they can pass it, but they have to, calm down and then start studying as if they were still in med school and all. And you can imagine, sometimes it's tough. Sometimes it's easy for some people. So what am I trying to say? I'm not trying to say that when you don't put in that work, when you don't, like, if you follow the right guide and all of that, what I'm trying to say is that if you put in the work, if you follow the right guide and all of that, you will still see yourself practicing as a physician in Canada in a short while. So now I'm going to go ahead to tell you the different pathways. So they have IMG pathways, they have the practice readiness assessment pathway, and they also have the pathway for the consultants, like people that are already practicing in other fields. So for the ING pathways, it's for those that just came out from uni, they went medical school that is, that is accepted or that is accredited or that is in the World Medical Book Directory. And then those people can go through the pathway of writing what they call medical certificate exam, that is MCCQ exam. Usually it used to be MCCQ1, MCCQ2, and NACOSCE, but now they've scrapped MCCQ2, and what they usually do now is MCCQ1 and NACOSCE. And then MCCQ1 is basically those things you do in the runs, those things, like, trust me, that are just the simple things that you see every day in the general practice. They're not asking you to, they're not calling you to come and start memorizing the anatomy and all of that. It's basically, they are purely clinicals. Then the NACOSCE is what we all know, like the normal OSCE and all. So those are basically the two exams. So for people that are going through international medical graduates, those ones, for instance, someone that haven't even done a house job, they just graduated fresh from school. So those ones, they will just write these two exams I spoke about. And then the next thing they want to do is to apply through residency matching. And now, if you're going through this pathway, what you want to be sure that, okay, you have a strong resume. You want to be sure that, okay, that your score in MCCQ is high. If you get like something like in the 260s to even 250, depending on the specialty that you want to be matched. If it's family medicine, you're good. Family medicine is only 2 years in Canada. You get matched and then you follow that pathway. So for people that have done house job and probably have done youth service, like independent practice, 2 years of postgraduate practice, those ones, they also have their own pathway, which is what I'm going to be showing us. Then for the consultants, the pathway that they follow is like, it's more like writing the certification exam and then getting in there. So basically, what are we talking about? What we're talking about here is that there are different pathways. So I'm just going to show you pathways for like 1 or 2 provinces in this video, and you see for yourself. We're going to walk through it together. You see for yourself how it is, because all of these things are there. It's not like coming here to talk about it and I'm not sure, this is my field, and if I want to talk about it, I want to talk about it authoritatively, right? So these are the licensing, these are the pathways that they take in this area. For instance, I'm going to be using this Nova Scotia. Nova Scotia, we all know, is in constant need of immigrants. It's a very beautiful province to live in. It's lovely. They are very welcoming. They are warm and all. So we're starting with Nova Scotia, and their pathways, their requirements for physicians is not that it's really friendly. Like, it's really friendly. Let's say, for instance, you've done your house job, you've done your youth service, that's like 2 years of work experience, okay? And then you want to follow this pathway, and then, okay, look at it now. This is the website. And remember, before you can start anything, you want to, if you click on this website, you want to click, this website is International Medical Graduates in Nova Scotia, okay? So, okay, in Nova Scotia. So now what you want to do is to click on the, you can start here. Okay, this is the first thing you want to do. The first thing you want to do is to have your documents evaluated. Okay, and this is where you do that. Probably I'm going to make another video on how, if people require that, if people want me to do that, I can make another video on how you can get your documents evaluated from beginning till end. Okay, we can do that together. So, but this is the website where you're gonna click on, so you can do your document verification and all. That is the first thing you want to do. And after that, look at this website, then let's go together. So register with the Medical Council for source verification. So this is the website also, physicianapply.ca. Now, if you've done this registration, it might take about, and I want to also say that in Physician Apply, you don't want to start before people, I don't know, people say, oh, you want to have to use DHL to send. They don't do it anymore. They have the email they provide where you can just submit all of these documents on their email and save that money for, that you were meant to use for through DHL, because they have email where you can attach all of these documents and have it verified. There isn't actually any difference between using DHL and submitting it to their email. It's still the same process and all. So you get through that, and then what you want to do is, okay, look at it now. So for those requiring additional training, if you require additional training, this is the pathway. So this includes, so the pathway for those requiring additional training, okay? Now, these ones, they have pathway A and they have pathway B, okay? But the first thing you want to do are those 2 exams that I made mention of, sorry, on the beginning of this video, MCCQ1 and NAC-OSCE. Okay, that is, MCCQ1 is Medical Council of Canada Qualifying Exam Part 1. NAC-OSCE is National Assessment Collaboration Objective Structured Clinical Examination. Now, if you follow in pathway A, which is the Hosi Clerkship Program. So let's say you just came out fresh from anywhere, Nigeria, Philippines, India, Canada, sorry, not Canada, anywhere that is not Canada, US, something. So now, or even UK. So you go through this and you say, okay, I've reading my MCCQ1, I've reading my NAC-OSCE, and I don't want stories. I want to just go through this, the Hosi Clerkship pathway. So that one, you're entering in 3rd year. okay? So you're gonna start with third year, and then you graduate from this university that I'm talking about, okay? And then when you graduate from this university, you do return of service and you start practicing. That's it. This is one of the pathways, okay? Then for this other one, let me quickly click on this so we can see. For this pathway, you have to be a PR in Canada if you want to go through that pathway, okay? So then you can apply through Dalhousie University and then get in there. So you can see this is what the program entails, okay? So you're basically getting in from third year. It's usually 4 years, right? So you're going in there to start from fourth year, okay? So you can see the admission requirements. Okay, so you can click on this to see the admission requirements, okay? So this is the minimum academic requirement. For that, this is gonna be, start diverting us. This is not what the purpose of this video, and I don't want this video to get longer than now, but you can also see this for yourself from the link that I will be providing. So now let's go back. So this is for the Dalhousie, okay? So this is the pathway A, and you have the pathway B. Remember, all of these pathways are after you've taken your MCCQ1 and NACOS care. So you have pathway B. So the residency training through Canadian March, that is for those who want to do the residency March. They say, okay, I don't want to do the Dalhousie one. I want to get matched and all. So this is, you apply through CAMS, okay? And then apply through CPSNS for postgraduate license. And then when you succeed, when you complete your residency training, if it's in family medicine, it's just 2 years, then you pass your family medicine exam, certification exam, and then you're eligible for full license. Okay, this is the pathway. And in this pathway, no one is telling you to go to village, practice, and all of that. Okay, now that is one of the pathways. Okay, and then if you want to go through the other way, okay, so the one is a pathway. The other one is pathway C. Okay, they have pathway C and pathway D. So a certification of family physician through recognized training and certification outside Canada. Okay, so now for pathway C, if you want to follow pathway C, you must be eligible to apply for CPSN for full license eligibility. You secure a job offer, then you apply for full license. If you want to follow pathway D, if you're ineligible, you apply for CPSN for referral to Nova Scotia practice readiness assessment, okay? So let's say that CPSN, okay, how do I even put it in a way that just to make it simpler for us, like in a way that everybody will, follow. Okay, now let's just say that, how do I even put this now? Let's just say that, okay, now let's see eligibility assessment for the College of Physicians and Surgeons of Nova Scotia, because this CPS, sorry, I didn't mention the full meaning of that initially. So this CPSN, okay, so CPSNS is another name for College of Physicians and Surgeons of Nova Scotia. Okay, so the full eligibility assessment, okay, so first of all, you have to be eligible, okay, so this is, if you want to check, okay, if, let's say you are eligible for that, they have the full eligibility. If I go into that, it's going to elongate this video. I don't want this video to be longer than that, and we're focusing on those who have probably finished their house job or postgraduate work experience, or at least 2 years postgraduate work experience, which is equivalent in Nigeria. It could be house job and youth service is something. And then this is the pathway. And then the pathway for those that just came out and they didn't have house job, and perhaps the pathway for consultants. So now, if for instance, you're already a consultant and then you meet the eligibility, Okay, so this is for the full license eligibility assessment. Then you secure a job offer, and then you apply through this for a full license. For instance, already a consultant and all. Okay. Now, if you're going through pathway D, let's say, okay, you just finished your house job, you just finished your youth service, you've done your independent postgraduate practice, and then you want to start this process, okay? You want to start this process. And in this process now, if you want to go through this particular process, what you want to do is, okay, so let's say you're ineligible and apply, you go through what they call practice, Nova Scotia Practice Readiness Assessment Program. Okay, this is for those ones, the ones that I was trying to explain earlier. Okay, now let's quickly check for that one. Okay, so now if you want to go through the pathway for the Practice Readiness Assessment one, they have eligibility for that. Okay, so now what we want to do is, let me show us what you can do to become eligible for that. Okay, to be eligible for that, you must have a full requirement for license application to practice in Nova Scotia. Okay, so now let's go to full requirement for license to practice in Nova Scotia. Okay, so look at it here. Number one is what I explained earlier, medical degree from the school listed in the World Directory of Medical School. You must have a valid work permit, permanent residence, or Canadian citizenship in Nova Scotia. You meet the English, you have the English language proficiency requirements. You provide criminal record check, okay? So, and these are just what you need, okay? Now, let me go back. I'm just gonna be taking us a lot of back and forth, if you don't mind. So now you must be LMCC, so Licentiate of Medical Council of Canada, or qualify for an acceptable alternative to listen. Now let's see what is this qualified alternative to listen to LMCC, okay? So now this is the qualified alternative. Now, if you have USMLE step 1, step 2, and step 3, you're qualified. If you have federal licensing examination components 1 and 2, you qualify. If you have MBME part 1, 2, 3, you qualify. So you can just go through this on your own and you will see, but I just quickly want to go down to probably for people who are, you know, from Nigeria, Africa, or other countries that are doing house job, youth service, and the rest, okay? So they said, excuse me. So if you have a recognized MD with a past standing from MCCQ1 and at least verify at least 1 year, look at it here, people, 1 year of verified postgraduate training. This is like house job in Nigeria. This is like postgraduate training in Zambia, in Ghana, in like, you know what I mean, okay? Remember, you must not have all of this if you have just one of all of these things that are mentioned. Okay, so another one is you might not even write the exam if you've had a minimum of 5 years of recent practice as the most responsible physician after completing postgraduate training in the specialty which they intend to practice. Practice experience must be up to 900 hours per year. And I'm pretty sure that a lot of doctors in Nigeria work more than, oh my God, what's 900 hours? They work much more than that and must be satisfactory to the registrar of. So what am I trying to say in summary is that you are eligible. You are eligible. If you're still watching this video by now, please subscribe to my channel, like and share with other medical doctors, share with people in your WhatsApp group. Someone might be eligible and they don't even know. Someone is gonna come out tomorrow and tell you, hello, Thank you for whatever you shared on the WhatsApp group. It helped my life. My family and I are living better in Canada now. So please remember to share. If you're still here with me, please remember to share right away and come back, continue with me on this journey, because we're gonna see the end of this, so that I will show you that you are eligible to practice. It's just the information. So now this is the practice NSPRA. Okay. So for the NSPRA, if you're qualified for that, what you do is after you must have reading, you can see. So let's read it together. The Nova Scotia practice readiness, that's the practice readiness assessment. I'm just gonna be using practice readiness assessment for short to save our time and for me not to bite my tongue. So it's an assessment program that ensures that international medical graduates who wish to practice family medicine in Nova Scotia possesses appropriate clinical skills and knowledge to provide quality patient care. So NSPRP operates under the auspices of the wholesale university, financial support of this. So all of these are not actually important. Okay, there's a main reason, that we are here. Okay, so now the NSPRP, what you do is after you've reading your MCCQ1 and NACOV scale, and you've had that 2 years experience that we spoke about, you go through that pathway. Okay, so that pathway is you must have practiced in, of course you've gone around like in family physician. And by the way, this pathway that I'm talking about is for those that want to practice as a family physician. So, but if you don't want to practice as a family physician, and even though you've had 2 years postgraduate experience, okay, or even more than 2 years postgraduate experience, okay, and then but you like, oh, you're not a fan of family physician, you can go through the other pathway, which is the IMG pathway. That's the one I spoke about earlier. That's the one that you write the MCCQ1, MCCQ2, and then you have very high scores in them and you get matched. That's also the one that I spoke about, that wholesale university, getting into 3rd year. But I want to believe that if someone is not ready to go and practice family physician, like you have a selection that, okay, I must be a surgeon, I must be this, I must be that, then I want to believe that you also have the patience to, wait, or, to have that wait until you are able to get all the results and all of that. But for people that think that they have passion for family physician, or they want to get into the system, those ones are the ones that can take this pathway that I'm talking about. So now after they've reading the exam, they will need to do 3 months of practice readiness assessment. This is where they will be under the how do I put it? They will be under, okay, they'll be under a physician, okay, where they will learn more on the practice of Canada, and then the physician will assess them based on how they practice, what they do, and all of that. Okay, so after that practice readiness assessment, you will move into their provinces to serve, like giving back to the society for a particular period of year, depending on what you signed. And then when you move to that provinces, after signing that, then you can now apply for your full license registration and you can start practicing. And mind you, when you are practicing, you are still practicing. When you are in the provinces, in the inner provinces, you're still practicing as a physician, you still prescribe, you still get all your pay, like all the heavy pays they make, you still get it, like no one is stopping you. But by the time you've served you've given back to the society, for them allowing you to take that short pathway, is kind of a way to say, thank you for letting me take that short pathway. You serve the community, or you serve the province, the inner provinces, and then you come back to the, maybe to the city, depending. Some people, after serving the provinces, they decide to even stay there with their family. Some would want to, like, all of this depend on individual differences and what someone wants, okay? So, and after that, you can move to the, wherever you want to move, this province, the city, and then start. or you can start your own clinic and get a space and start your own clinic and start accepting patients. And yeah, and this is how your career starts. Okay, I've seen some people that started that way. They came in as family physician and they did that. Probably over time, they felt like, oh, well, it's like I'm not having the vibes anymore. They still went in through the marching and probably started whatever, maybe surgeon, pediatrics, or even whatever, you know, like people are not restricted to being one profession. That's what I'm trying to say. Okay, so even if you started as a family physician, no one is saying that you want to be there for the rest of your life if you do not want. But if you want to be there for the rest of your life, you're welcome to be. If you want to be up to 3 different specialties, it's up to you. If you have the strength and if you're able to, you know, bend down and do the work, that is really up to you. But what I'm trying to say is that Canada has open space for you. Canada have their arms open for you to come in and, you know, save lives, to come in and progress in your career, to come in and they provide even these exams that I'm talking about. In many provinces, they provide free tutorials for that. They provide free materials for that. They provide, you know, like they are there to support you as a physician to get into the system as it stands at the moment. Okay, so this is for this province. I would just quickly want to go over another province. Okay, I quickly want to go over another province. So this is the same, what I just said. There's another province that is called British Columbia. This province also does exactly the same thing that I spoke about. They have a practice readiness assessment too, where you will just do for 3 months or day a physician, and after that you can just be on your own. So what you just did was write the exam and finish the 2 exams, do the practice, apply for practice readiness assessment, do the practice readiness assessment, and after that you proceed to to practice on your own. So this is for the British Columbia too. Okay, so you can see successfully completion is always and always, of course, you must graduate from a med school, right? And then 2 years of postgraduate training in an international jurisdiction, leading to registration or recognition of general or family practice in that jurisdiction. Do you understand? Demonstration of 7 core rotations. So you are expected to rotate at a minimum of 4 weeks of postgraduate training in each of these: internal medicine, general surgery, obstetrics, ONG, pedia, psych and emergency. A minimum of 4 weeks of postgraduate training in family medicine. Okay, so different provinces have different requirements. They still need NACOSK. You can see this for yourself if you want to go around it. This is still the same website that I spoke about. Okay, this is still the, okay, yeah, we're still. So basically this, and also you want to check for British Columbia as well. Okay, you want to check for, sorry, I spoke about British Columbia. You want to check for New Brunswick. So many projects. You want to check for Manitoba as well. Okay, so these provinces that I've listed are waiting for you. They are waiting for you. Their arms are wide open. So if you want us to go through, I'm just trying to rush this video. One, because I know that my colleagues are smart. I don't need to even explain. I know they already understood what I'm talking about. However, I'm also still gonna leave a link of all of what I'm talking about so you can go and see for yourself what I'm saying. I'm not saying something that is not on a website, or I'm not saying something that is not that is not written anywhere. That is what I always tell people. When people tell you something, always ask them, please, can you send me the website? Especially in the Western world, because people can go about with all sorts of negative or all sorts of, not so good information, and people might just be acting on that. Imagine the myth that most medical doctors in Canada are driving taxis. That's, I would want to, categorically say that you want to talk to those people and know what's going on, if they'll be sincere. Okay, so for you to be eligible to work as a PRA that we spoke about, you must be eligible, you must be legally entitled to live in Canada, at least work permit. Okay, so you must not be prohibited or restricted from practicing medicine. Like, it's not like when they took your license, probably they've taken your license from wherever country you're coming from and you decide to come over, it's not gonna work. Okay, so you can see the credentials you need is your MD credential. You need your Medical Council of Canada, MCC. So that is the LMCC, the one that I spoke about at the beginning of this video. I also showed us the link. I'll put up all of these links for us. So confirmation of your postgraduate training, a certificate of completion of training or letter confirming completion of training. Okay, so certificate of registration, medical licensure. So a certificate of registration is official issued by medical authority of the registrant to practice medicine. So of course, everyone, most doctors have their certificate of registration. So for the English, they need to have English, okay? In accordance with, I don't need to start reading all of this, okay? So you must be eligible to communicate with patients in English and other professionals in English. So you can do OET or you can do IELTS, but I would want to go for OET because OET is basically what you do every day in the hospital, sending requests and all of that, sending consults, I'm sorry, and all of that. So look at where they want you to have your postgraduate training, okay? So, and then that is it. So if you had at least 24 months of family medicine or general practice with a minimum of 8 weeks of 8 weeks minimum successfully completed in these rotations, you can see all of them. So can you see that a lot of people are eligible? Okay. So you must have at least 2 years of unsupervised independent practice. Okay. And then you can now move through PRA practice, PRA pathway. So yeah, that's basically it. I've listed, in this video, I've explained the pathways to move into Canada. I've explained the pathways. Then the consultants, for the consultants pathway, those that are already practicing, like maybe a consultant gynecologist, and they also have their own pathway. That one is, they just need to register. They already qualify for LMCC. All they need is just to take an exam. That is for their own specific exam, and then they can now proceed with it. So this is not as complex as people out there are saying. It's not as complex as everyone is. I don't know the information that is flying out there, but if you see this video, share with people, you might be helping people. A lot of the chiefs out there are actually eligible, and they probably did not know, and they might just be thinking, oh, is this, is that. So please, Canada, we want physicians, we want doctors to come over to Canada and help save lives. We have shortage of physicians, and Canada is hungry for physicians. Canada is hungry, very, very hungry for physicians. So please, all physicians should come to Canada and, you know, help to save life and continue in career progression. So I'm just gonna come to the end of this video. And if you've stayed to the end, please remember to subscribe, like, share this video, please. You might just be saving someone's life, and trust me, they're gonna be grateful to you tomorrow for saving their lives and by sharing this video. Information is key. Information is key. Remember to like, remember to comment, and thank you. And I want to show you whatever it is that you're planning someday is gonna come to materialization. Just hang in there. Trust me. It's just gonna be a short while, and everything will be put together, and they will make sense. Even if they're not making sense now, trust me, someday you're gonna sit down and remember that, oh wow, I remember when I was searching all the whole YouTube, finding a way to become a physician in Canada, and today, look at, I've just made it. And I wish you good luck, and thank you for